Welcome to Chapter 3, which is on adverse reactions. When I think of adverse reactions, I think of bad things that could happen when you take drugs. And bad things could be overdose, bad things could be upset stomach, bad things could be hospitalization. So we're going to look at different adverse reactions that people could have with certain drugs. So let's look at some definitions. When you take a medication, we would hope to see therapeutic effects. Therapeutic effects means that this medication is working. Maybe you were sick and you took this medication to feel better. So the therapeutic effect is, feeling better. It's a desirable action. An adverse reaction is a side effect. So if you took this medication and you had an upset stomach, for example, that's an adverse reaction. That's a side effect or an adverse effect. An adverse drug reaction is when it gets when the side effect is really bad, harmful potentially. So you take one pill and all of a sudden you find yourself at the hospital because you feel extremely unwell. That would be an adverse drug reaction when you have a harmful side effect that's bad for you. So there are many different categories of adverse drug reactions. There's many different categories of how drug can be bad. So for example, there's something called toxic reaction which is when you take a medication and maybe you took too many of that medication and now you have a drug overdose. That is considered a toxic reaction when someone didn't follow instructions and had a toxic reaction. Then there's side effect, which is just a general non-desirable part of medication where you may get an upset stomach, where you may find that you're going to the bathroom a lot because you have soft stool or diarrhea, right? All those where sometimes people say that they're having headaches with that medication. There's lots of different side effects that could happen with different medications. We're going to look at idiosyncratic reaction, and this type of reaction is when it's genetically related, when only certain specific type of people experience this reaction. So for example, studies show that if Eskimos or Inuits, they tend to digest drugs or metabolize drugs faster than us regular people. So for people who are Inuits, they need to be given a higher dose so that the drug can actually work effectively. So there are certain populations or certain types of people that have an abnormal drug response where they need an extra dose or extra larger dose of drugs for it to work. So that's an idiosyncratic reaction. Certain populations have abnormal response. Drug allergy. If you take a drug and you break out in a rash, or you break out in hives, which are those red things, or you go into a shock, for example, an anaphylactic shock. So you could be allergic to drug. I'm allergic to penicillin, and when I take penicillin, it's not like a life-threatening allergy. It's one of my doctors said it's actually not really an allergy, it's just a side effect. So I get hives, and she told me it's not really an allergy, it's just a side effect. Hives, which I found interesting because I don't ever want to get hives all over again, but I was told it's a side effect, not an allergy. So sometimes if you get a rash or anaphylaxis, then that is considered an allergy. And there's lots of people that do have allergies. In dentistry, people could have latex allergy, where you have to make sure you don't wear latex gloves in front of them because then they could break out in hives. Their lips could get really swollen, right? So it's just things to watch for. Always ask your clients if they have any allergies. And then lastly, sometimes when you take drugs, it could interfere with your natural body mechanism. So for example, if you take this medication prednisone, and prednisone could be used for many different things. So let's say you're taking prednisone for arthritis, for example, and let's say now you fell sick. If you fall sick and you're taking prednisone, that's bad, because prednisone, unfortunately, doesn't help you fight infection, doesn't help you get better. Prednisone is only going to work with arthritis, and it's going to decrease the chance of you feeling better or fighting infection. So you kind of don't want to get sick, or you don't want to get infected with something when you're on prednisone, because when you take this medication, it diminishes your ability to fight infection. So whenever you take a medication, you need to always you need to make sure that the benefits outweigh the risk. Okay? So there has to be more good to your body than bad. So for example, if I had a severe infection and the only medication that would work for my severe infection is penicillin, but I know that with penicillin I get hives, what I have to do is I have to weigh out the pros and cons. I have a severe infection, I'm likely going to take penicillin. That is better so that I could become healthier and recover compared to getting hives. So getting better to me is higher in the scale compared to getting hives. So here I'm outweighing the risk and benefits, and to me, yes, there is a risk, which is hives, but in the grand scheme of things, hives isn't such a big deal because I really want to get better. So I'll put up with getting hives, but I'll take that penicillin medication because I know this is my road to recovery. This is the way for me to recover. So I'm outweighing the benefits and risk. And that's what we should do whenever we take any medication. That's what doctors do too. They outweigh the benefits and risks to decide whether to give you a medication or whether to give you that specific medication or not. So sometimes we get exaggerated effect on targeted tissues, and that basically means you may have a sensitive reaction. So if your body's too sensitive, it may react in a weird way. I'll give you an example. Let's say you're diabetic, and let's say you have low blood sugar. Okay, so when your blood sugar levels are really low, what can happen is you could start sweating, you could get headaches, you could start getting shaky. So when this happens, you need sugar. And there are drugs that will give you sugar. There are drugs that you take and sugar will be made. So let's say you take a drug that helps you get blood sugar, that helps you increase your blood sugar levels. What happens is the drug goes to the liver, and the liver makes more sugar, makes more glucose. But sometimes when the drug goes to the liver, when the drug goes to the targeted tissue, which is the liver, that's the target, the liver doesn't respond. The liver doesn't make glucose. And there are many reasons why that could happen. The liver is supposed to be making glucose for you so that you feel better, but in this case, the liver didn't make glucose. It backfired because maybe the liver is too sensitive. Maybe something happened and the liver is just backfiring. Maybe you took a dose that was too large. So you took too much medication and the liver got confused and is not able to produce glucose. Maybe you took the medication without food and the instructions were to take the medication with food. So if you screw up the medication instructions, the instructions that you're supposed to be taking, if you take a dose that's too big, if you take a medication without food, that could really affect why the liver didn't give you the glucose. So that's when you have an exaggerated effect on targeted tissue. The target here was the liver. The liver was your target to give you glucose, and it failed on you. The liver backfired. And sometimes you can have effect on non-target tissues. So if you take aspirin for pain and all of a sudden you feel your stomach is getting upset or your ears are ringing, that's non-target tissues because your pain is in your knee, for example. So the knee has nothing to do with the stomach or the ears. But if you take, a dose that's too big, sometimes you could get ringing in your ears. This is also called tinnitus. Teratogenic effect. When I see this word, I think of pregnancy right away. So just memorize that. Teratogenic kind of means pregnancy. If you're pregnant, you want to be careful of what medication to take. There was a tragedy that happened in the 1960s, I think it was 1961, where mothers were taking this medication over here, and the medication is called thalidomide, and any mother that took that medication when their babies were born, they were all born with short arms and short legs. So that is an effect. That is a medication or a teratogenic effect that happens when people are taking this medication. So after that, no one is taking this medication when pregnant. And this one tells you what medication is safe for you to take in dentistry or any time, and what medications are not safe for you to take. And one of the medications we strongly discourage pregnant women to take is tetracycline, because one of the things you'll learn is if you were to take tetracycline, the baby or your fetus could have, when they get older, they could have teeth that have tetracycline stains, and that unfortunately you can't get rid of. And then sometimes you can take a medication and so like a cream, and it can give you a local effect. So it can start itching, you could get pain, it just lots of irritation could happen. Or when you inject, when you get like a needle, it could cause irritation, it could cause pain, it could even cause tissue necrosis. Tissue necrosis is they're eating away your skin, right? So there are lots of side effects that could happen with creams and even with needles. It's important to know what drug interactions are, because if you take one drug and you combine it with another drug, sometimes that drug won't work. You'll get decreased action of that drug. If that drug's supposed to make you feel better and you take it with this drug, it doesn't make you feel better. If you take a drug with another drug, sometimes you can get increased action of drug. So if this drug was meant to give you sugar, for example, so if you have low blood sugar and you take this drug to give you more blood sugar, and then you combine it with this drug, well, maybe now you have extremely high blood sugar, too high. So sometimes you could get an increased action of drug, where you get too much of something that you don't need. And sometimes you can get adverse effects. So if you take this drug with this drug, your stomach could get extremely upset. You may break out in hives. There's so many different things that could happen to you. You may get headaches. You may get, diarrhea. So drug interaction is when you take one drug, you combine it with another drug. You need to make sure that there are no interactions, because that could have effects on you. Interestingly enough, if you take grapefruit with some drugs, what can happen is, so let's say this drug is 20 milligrams. So you take 20 milligrams of this drug, then all of a sudden you go and you have a craving for a grapefruit juice or eating grapefruit. When you combine those two, all of a sudden the 20 milligram drug became 100 milligrams in your body. It just, you kind of got an overdose of that medication because you drank grapefruit. Or the opposite can happen. If this is, let's say, 50 milligram and you take grapefruit, all of a sudden the amount of drug inside your body is only like 5 milligram, for example. It's a reduced dose. So grapefruit actually does have an effect. There is an interaction between grapefruit and the drugs. Here's an example of idiosyncrasy. So idiosyncrasy is when certain types of people are affected with a drug. So here's an example of a black male. So this is only happens in black males. And certain black males, if they take this medication, this is for malaria. So primaquine, if they take primaquine, and they have malaria, what can happen to some of them is they could get severe anemia, and that's really bad. So it's an example of an idiosyncratic reaction, because it only happens to those specific population of people. It may not happen to me, but it may happen to someone who is a black male, not necessarily female, but a male, and they can get anemia, which is low red blood cells. Okay, here's something that you need to know. So this is like how people find out whether a drug is toxic for you or not. So they do an evaluation, a toxicologic evaluation of drugs. And what they do is they do this test on animals or rats, and they figure out how much of the drug kills 50% of the animals and how much of the drug works in 50% of the animals. So let's just say that there was, let's just say 200 milligrams. So I'm going to put 200 milligrams here. there were let's say there were 10 animals. So 1, 2, 3, 4, 5. 1, 2, 3, 4, 5. So 10 animals. They gave each animal 200 milligrams. So all this animal, 200 milligrams were given to all these animals. And what they noticed was that 50% of them died when they were given 200 milligrams. So let's say this animal died, this animal died, this animal died, this animal died, and this animal died. So 200 milligrams, 50% of them, half of them died. And then let's say the median effective dose was 20 milligram. So again, we have 10 animals, let's just say hypothetically, and those 10 animals were given 20 milligrams. So this one was given 20 milligram, this 20 milligram, 20 milligram. So each animal was given 20 milligram. And they noticed that 50% of them, so I should say, it worked. 20 milligram worked on this person, 20 or this animal, 20 milligram worked on this animal, 20 milligram worked on this animal, 20 milligram worked on this animal. So this dosage worked. It helped these animals feel better, for example. So what people do is they do something called a therapeutic index. They figure out whether that drug is safe for you. So what they do, there's a formula. They take the lethal dose, so 200 milligrams was the lethal dose. They divide it by the effective dose, which was 20 milligrams. And when they do that, they get a number like 10. If the number is low or small, then it could be toxic. So let's look at this example. Let's say the lethal dose was 90 and the effective dose was 30. When you do 90 divided by 30, you get 3. Low number is bad. So this is a bad medication because it's more toxic. But if you give this medication, 10 is not so bad, it's less toxic. So the lower the number, the more toxic it is. So this is bad. You don't want to ever take this medication. This is okay, it's higher, right? The number is higher. So the higher the number, the better it is. So this medication is good, this medication is not good. So it's important to recognize the adverse drug effects. And one of the things we'll be doing is we'll look at different types of drugs that clients take, and we'll analyze the drug and we'll see what the side effects are and why does it matter to us. What we should as hygienists do if someone was taking a drug and if there were lots of side effects, how would it affect us? What do we have to do differently to help those people? And that's what we'll learn about in the next section.